that time.
Shall we?
Let's go ahead. We'll begin with the Pledge of Allegiance. I
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Good morning. Welcome to the April 22nd, sorry, off a day. Welcome to the April 22nd, 2024 meeting of the Shawnee County Board of County Commissioners work session. My name is Kevin Cook. I serve as the chair this year. Joining me today is Commissioner Aaron Mays. Good morning.
Good morning.
Commissioner Bill Rippon. Good morning.
Morning.
And our county councilor, Mr. Rickard, is also here. We do have on our work session for this morning the Grace Med for an update for what's going on with our federally qualified facility here in Topeka, Shawnee County. So I'll turn it over to you.
Thank you. Good morning. My name is Dr. Julie Elder, and I am the Chief Medical Officer of Grace Med. I've been there for almost 11 years, and I recently started serving as the interim CEO about a month ago when we had a change in our administrative staff. So I realized that we have failed to report over the past several years. So today, I am here to kind of give you a summary of what we've been doing over the past several years and kind of where we're at now and where we're going down the road. And for the sake of time, I know this is a short presentation, but I've given you a handout, and I'm sorry it's microscopic in some of the font sizes. So I'm happy to send you an electronic version if it's easier to read. So as most of you know, we are Grace Med. We are a faith-based, federally qualified health center, and we're here to serve the community. We're here to serve regardless of a patient's ability to pay. And we go by our mission statement, really. We're here to just show the love of Christ by the way we provide care. We provide both medical and dental care. We make it accessible and affordable to the community. And we really do tend to focus on holistic care, the whole person, not just the physical needs, but the emotional and spiritual needs as well. We currently have a good group of clinicians at both of our clinics here locally. We offer pediatrics, family medicine, podiatry, optometry, and prenatal care. Like many other medical organizations, we've been affected by the pandemic and the workforce shortages that were associated with it. I'm happy to report, though, that we're seeing the light at the end of that dark tunnel, and we're starting to see new faces come on board again after a long hiatus of short staff. We also have 2 behavioral health providers on site, one at each clinic, and then we also offer dental services to the community with 2 full-time dental providers. Now this slide here shows you the number of clinicians over the past several years that we've had. We're currently sitting right around 11. We have a new nurse practitioner getting ready to start, and Dr. Blaker actually just is starting this week. So we're excited, like I said, to have some new faces on board. Now the next several slides will show you numbers, and this is where it gets a little tiny in the font. I'm trying to capture several years of data in a 5-minute presentation, so just bear with me if you would. But what you'll see is that in 2020, just kind of on the heels of the outbreak of the pandemic, we were sitting at around 21,000, almost 22,000 patient encounters for the year. We were also very full staffed at that point. And this slide gives you kind of a breakdown of the demographics of the patients we serve. You'll see that our primary language spoken by our patients is English, but Spanish is the next popular language of our patients. The predominant race is white, and then non-Hispanic or Latino is the most common ethnicity. Most of our patients fall in the age ranges of 18 to 64 years of age, but we do see folks that are older than 65, and then certainly pediatric patients under the age of 18. And that slide is broken down by quarter throughout the course of the year. And for the sake of time, I won't go into details, but this gives you a quarterly breakdown of 2020 of our medical encounters and then also our dental encounters. Now in 2021, you'll see that we actually had an uptick in our patient volume. We saw around 26,000 patient encounters for the year, and I think that was probably a lot due to being, still full staffed around that time, but also patients were starting to trickle back into the clinics. For a while, when COVID first started, nobody wanted to come in, and we were doing a lot of remote work, telehealth work. But towards the end of 21, middle of 21, we were starting to see patients in the office again, and patients were feeling more comfortable coming back in to see us. And again, this just breaks down race, ethnicity, age, and language spoken. Very similar. You'll see very similar slides throughout the years on those. And then again, total medical encounters for that year, and then dental encounters as well for each quarter. In 2022, we saw just a slight drop in patients, 23,000, close to 24,000 for the year. And again, very similar breakdown with language, race, and ethnicity, and age. Patient encounters, medical encounters, and then dental encounters as well. In 2023, we saw a drop in encounters, and again, we had definitely workforce shortages in 2023. We saw a total of roughly 19,000 patient encounters. In 2023, we also started offering an in-house pharmacy, and that made 2023 a unique year for us. We were able to offer patients the 340B program. It's a federal program that significantly cuts the cost of medications for our patients, and so we were excited to be able to offer that at our Capital Clinic. It makes a huge cost savings for our patients. And again, a very busy slide, just looking at language spoken, race, ethnicity, and ages. And then total patient encounters broken down by quarter. And here's our our dental encounters broken down by quarter. And then this year, so far we're at 4,500 patient encounters for the year, and I only anticipate that this is going to go up. With the addition of Dr. Blaker and a new nurse practitioner, we're continuing to recruit for both dentists and dental hygienists, as well as medical providers. Right now, also, Dr. Whitlatch, one of our family med doctors, is serving as our prenatal care provider, so she is taking care of that patient population. And we'd like to eventually hire a full-time prenatal provider to take over that role. Like I said, we're really just here to serve the community, regardless of their ability to pay. During COVID, we've been available to the community for both COVID testing and COVID vaccines, and that continues. We've also, as I mentioned, opened our 340B pharmacy. We're also eagerly awaiting the opening of a grocery store on the site of our Capital Clinic. The Oasis group is a local group that's working on that project now. They're still in the fundraising process, but we recently had a meeting with them and were able to see the blueprints and the design for that grocery store. So we're very excited about that. We've also partnered with other groups locally, be it for homeless outreach, health access, and some of the other, even the health department during the pandemic. So all of that to say, even though we've had some changes in our staff and administration, we're here to stay, and we're excited to continue serving and doing what we do best, and that's taking care of patients. So I'm happy to entertain any questions that you might have.
Commissioner Mays, questions?
You mentioned a pharmacy. So you have a pharmacist on board?
We
then?
do. We have a full-time pharmacist. We're open during clinic hours, and it's actually in the Capital Clinic. As you all may recall, that used to be a grocery store, a Safeway, I believe it was, back in the day. And so there was an area in that building that was a previous pharmacy. So we just utilized that space, made it our own, and so now we offer those discounted meds to patients.
Are you lacking a certain doctor or profession that?
Good question. Right now, we have a good mixture of our team. Family medicine is our biggest need, but we do have open positions for clinicians, so we're continuing to recruit. Dr. Whitlatch, like I said, she's family medicine, but she's also been doing our prenatal coverage, and so we're hoping to fill a full-time prenatal provider position too, in addition to family medicine.
Do you have a system set up where you can have volunteer doctors come in on certain days?
Yeah, good question. Good question. We have had volunteers over the years, primarily in Wichita, not necessarily up here. So we're familiar with what that looks like, and we could definitely entertain that. We do have some collaborations in progress now, looking at capacity and how do we reach more patients. So yes, we're definitely working on those things.
If you have a patient that needs a specialty,
Mhm.
you have a means of getting them that kind of?
Yes, good question. Well, we do offer optometry and podiatry in-house, so those two are taken care of. Health Access is a wonderful resource here in the community, and that's a program that allows patients to apply for assistance through that program, and that will connect them with specialty care. Not every specialist volunteers their time to participate in that program, but it is a wonderful resource, and it would connect them. For example, if somebody needed a cardiologist or something like that, they could apply for Health Access and get the care they needed with that specialist, so.
Okay. I thank you for being here, and I knew that it had been some time since we had, during COVID, everything kind of got knocked off course, and so
Yeah.
we're still picking up the pieces and, correcting all of those and getting everybody back up to speed as we were doing. So thank you for being here.
Thank you.
And updating us, and we look forward to having updates in the future from Grace Med, especially as it relates to adding more medical
Yeah.
staff. I think that's probably one of the concerns that I've heard out in the community in speaking with providers is, I know that for a while, your facility was struggling with getting staff, and I know that even at the health department, we've struggled with having nursing staff, and even the hospitals themselves have struggled with staffing. So staffing seems to be a reoccurring theme along with a lot of medical providers.
Yeah, yeah, I think you're right. I think and I don't think it's local, I don't think it's been a national issue, truly. But like I said, I'm hopeful in that we're starting to see more staff come on board and more new faces join our team. So I'm staying optimistic.
Okay,
Thank you very much.
thank you. That is our only presentation for today, so with that, is there any public comment? Any administrative comment? Commissioners, any comments? All right, well then, we'll be back here on Thursday. I know that we have a lot on our agenda for Thursday, so we'll be back, we're adjourned until Thursday.